coming to the overview. So electrolytes, what are the importance? Sodium is an intracellular ion. It generally stays in between the cells. It helps in maintaining the normal plasma osmolality. If any changes happen in the levels of sodium, our brain gets affected. When I say the brain gets affected, what are the signs and symptoms of a person having hyper or hyponatremia? The person will have epilepsy, convulsions, seizures, all those symptoms of the brain. Now, potassium is generally an extracellular ion and it is important for the conduction of nerve impulse and for cardiac rhythm. Any changes in the levels of potassium, our heart gets affected. And how will you know if it is getting affected? You will look at the ECG. If you see a change in the waves of the ECG, that means the potassium levels are changing. Now, calcium levels is necessary for the bones and the blood clotting and in the muscle contraction. Okay, phosphate ions and calcium ions work together to maintain the bone framework of the body. Altered levels of calcium and phosphate, we know, because they are making the bones, they can affect the density of the bones, and if they increase in level, they can also cause stones, kidney stones. Okay, magnesium ions are very underappreciated. We don't know much about it, but they are really important because they help in the conduction. If the magnesium ions are at not proper level, the reflexes that we have can be in problem. The respiratory drive that we have, like we don't tell ourselves to breathe in or breathe out at every moment, right? It goes on. But if the magnesium levels are not properly maintained, the respiratory function can also have problems. Okay, what are the normal levels of the electrolytes? General normal levels: sodium is 135 to 145, potassium is 3.5 to 5.0, chloride is 98 to 106, bicarbonates are generally 24 to 30, calciums are in two forms, total and ionized, magnesium is 0.75 to 0.95, phosphate is 2 to 4.7, and pH is generally almost always maintained in the state of 7.35 to 7.45. Any changes in pH of the cell can cause big problems. Acid base balance, it is just a revision of what you guys already know, and I have only included one slide to give an overview that how will you know. I'm not going to ask many questions. I'll only tell you how will you know what metabolic or what respiratory disorder, what imbalance is going on. So what you do is, if you have a ABG strip in your hand and if you want to know what acidosis or basic condition is going on, first of all, yes, you will look at the pH. So normal pH is generally between 7.35 to 7.45. Okay, then if you want to make it easier for you and to understand, you draw like a diagram like I have drawn over here, and you put bicarbonate because B comes before CO2, so put bicarbonate on the top and CO2 in the bottom. Okay, now normal levels, you remember, is 24 and 40. You put it like that, 24 and 40. It is also going to help you with one of the MCQ which says what is the ratio. Ratio is generally 1 is to 20. Okay, 1 times bicarbonate to 20 times carbon dioxide. Now you look at, after looking at the pH, you will know if it is acidic or basic, right? So for example, say the pH is 6 or 5, you know it is going towards acidic. Then look at the bicarbonate. If the bicarbonate level is less than 24, then it is metabolic acidosis. But if the bicarbonate is not less than 24, it is somewhere over here around 20 to 30. So that's not helping you much, is it? So you look at the CO2. If the CO2 level is more than 40, then it is a respiratory acidosis. But if the CO2 level is not more than 40, then definitely it was a metabolic acidosis. Okay, that is how you will know. If the bicarbonate level is lowered, then that means that is a metabolic acidosis, and if the CO2 level is increased, that means it's a respiratory acidosis. Now how do we know? We always look at the bicarbonate levels, and the other thing that we wanted to know was about the compensatory mechanism. So when we say compensatory mechanism, so if bicarbonate is going towards this side, the CO2 has also to go towards this side. So if CO2 goes towards that side, it is having a compensate. So for example, if the bicarbonate levels is less than 24, that means the patient is going towards metabolic acidosis. To compensate it, the CO2 also has to go less than 40. Okay, so that is how metabolic acidosis and respiratory alkalosis, those conditions go together, and that is, you can say, it is compensated because CO2 is going in the same direction as the bicarbonate. If CO2 does not go in the same direction in the bicarbonate, like bicarbonate level is less than 24, it is in around like 20 or something, and CO2 is in this direction, like here, so that is confusing you, right? So that means it's a mixed problem. It's a very complicated problem, it's a mixed problem, and those conditions will take me another lecture, and so I'm not going to take you into those details. Okay, so that is all about your acid base balance. I hope it helps you when you're in the wards looking at the patients. Try looking at the ABGs, it will be fun. Try looking at it. If you face any problems, bring the ABG strips and we'll try and do it in the class. Okay, that's all for this lecture introduction. I hope some concepts are cleared. If you have any doubts or queries, you can always ask me in the email. Thank you.